Great. So a few months back, we were reflecting on the pandemic and how we could really benefit from a coordinated health communication system in Melbourne's West. And sorry, I've just lost my page. From our observations, there were lots of inefficiencies in the communications around COVID-19, a flurry of activity, and a lot of really good work, much of which was probably done by people who are present in this meeting today. But perhaps there was a lack of coordination across the region. And we wondered if a better regional system could help us in times like these to communicate more effectively and efficiently. And importantly, we know that that system has to be grounded in good health literacy practice, which is why we brought this research to this group today. So we sought the assistance of Anita Trezona to help us navigate the literature so we could get a better understanding of what that system might look like for us in this region. Anita runs a consultancy group, Trezona Consulting in Melbourne, and we were really pleased to have Anita work on this review with us, particularly with her expertise in health literacy, knowledge of PCPs, and also familiarity with the Western suburbs as well. So I'd like to welcome Anita to talk about the review and some of the findings she has learned through the review. Welcome, Anita.
Thanks, Tanya, and thanks everyone for joining. It is nice to see a lot of familiar faces that I've met along the way. So hopefully everybody can see this now. I'll just confirm people can see my slides. It looks like they can. And again, before I start my presentation, sorry, I'm having a bit of trouble here. I would like to acknowledge that I'm a settler on the lands on which I live and work. I want to acknowledge the Wurundjeri Woi-wurrung people of the Kulin Nation as the sovereign people of these lands and pay my respect to their elders past and present. I think Tanya's already given a pretty good introduction and context for this work, so I'll keep it brief, but I think what we all will have seen and observed either in our own work or as we've sort of watched on what's happening globally, I think we've been able to see that the communication has been a challenge across the globe. We've also seen the particular challenges in Australia. Obviously, Tanya touched on the sort of coherence and coordination being a challenge, and there's obviously lots of reasons for that. Obviously, the complexity of the information in itself, changing advice was happening so regularly, sometimes contradictory by the time those messages were getting out, and a lack of communication and engagement with culturally and linguistically diverse communities. I think it largely, despite a lot of effort, the system's obviously not really well set up to be able to meet their needs well. So Tanya's spoken about the context for Melbourne's West, and so recognising the urgent need to improve public health communication systems and approaches, they invited me to work with them on this piece of work and really have a look at the literature around evidence on communication systems, also good effective communication practices and approaches. It looks at those things broadly, but obviously also with a specific focus on whole communities. So there were a number of elements that we were sort of looking at through this review. What were the elements of a communication system? And I guess thinking about that at lots of levels, at a whole system level, but also what does a regional communication system look like? The effective comm strategies and approaches, and also community engagement strategies and approaches. And we'll see as we come to the findings of the presentation that these two things really do go hand in hand as a practice, particularly important in the context of pandemics and other health emergencies. So I won't bore you with the methods and results too much, only to say that it was a wide search, so databases and Google searches for peer-reviewed and grey literature. Obviously, we're still in a pandemic, so evidence is still emerging, but we'll sort of draw on other previous pandemics, other health emergencies, and instances where kind of crisis communication might be required. Interested in a broad range of evidence, obviously, hoping to sort of identify case studies or key lessons from other countries, but also obviously in the Australian context as well. So I do want to highlight that a lot of the evidence that we found, or that I found, was mostly descriptive. So it would describe what had been done or a practice or a particular initiative, but it wasn't able to report on impact or outcomes. So scoping reviews found a lot of evidence of good practice as per their descriptions, but there really still is quite a lack of evidence around demonstrating effectiveness. So I just want to highlight that to explain the nature of the findings that I am going to talk through. The first thing to say is that in the context of pandemics, there is a global mandate for communication and community engagement broadly. So it is a key pillar for pandemic preparedness and response as designated by the World Health Organization, and all WHO member states have to fulfill this function under international health regulations. So Australia as a member state for the WHO have this mandate. And also the World Health Organization provides a lot of global guidance to member states around policy, practice and technical. So this is specifically for communication and community engagement. And a lot of the literature that I found and a lot of the studies are really guided by this WHO approach and their kind of advice around how you do this. And in particular, lots of new ways in which the WHO is trying to encourage not just governments who are ultimately responsible, but how stakeholders can improve their communication and community engagement for pandemics and health emergencies. Okay, so I want to start by talking about health systems as a broad concept. Some of this will be familiar to you, I'm sure. People who've worked in other public health system areas will probably recognise these as kind of the building blocks for any good public health system. These really does align with the WHO health systems kind of work. So I'll just talk through these though in the context of how we can see the system more broadly and how that might relate to you at a more local or regional level. So obviously on top of those building blocks, we need good national leadership and governance, and also state leadership and governance to be able to, I guess, oversee, implement, finance a good communication system. So legislation is obviously determines who has which roles in Australia at a national and state level. They've got the power to make decisions about how they spend money. I think what we've seen is the politics of pandemics and the political nature of the decisions that are made, including what's communicated, is a really important part of whether a system will be effective. So I guess I want to keep that in mind as we talk through, in an ideal world, what does a good communication system look like? So those systems, building blocks, governance and coordination mechanisms, I think we could probably all attest to how important it is to have good coordination for communication if we're going to be consistent and we're going to get the right messages to people in a timely way. Making sure there's enough money to support communication specifically. It's not always an area that gets resourced in the way that it needs to. Policies and procedures, obviously very broad. It relates to high level responses, but also procedures for how you go about implementing consistent, coordinated communication. Planning, obviously really important, and I'm going to talk about that in a little bit more detail. Capacity building and the workforce. So what are the skills that people need, the training, the abilities to be able to communicate and engage with communities around what is really complex and technical information sometimes, and obviously lots of different community expectations and understandings as well. Monitoring and evaluation, we know this, we talk about this in all aspects of public health and the importance of it. I will talk about it in a little bit more detail as it relates to pandemics. In the middle there, regional and local partnerships, networks and stakeholders. It's obviously a very static diagram, this one, but this system is obviously really dynamic. Communities are important at all of these levels, and the way organisations interact with communities is really critical. Communication activities and practices and the community engagement as the processes, and then obviously lots of organisations being involved in implementation as actors in the pandemic response. So perhaps not a perfect way to present what a communication system looks like, but hopefully highlights all of the key elements, and also primes you for the type of evidence that I'm about to present and highlight. So does anybody have any questions before I keep going? No? Okay, so I'm just going to highlight really 3 key areas of the building blocks in a health system, because I think people will be able to relate to the importance of these in particular. So obviously we need strong leadership at a national and state level, and ideally what we would have is cooperation between those levels and a really consistent approach to communication and community engagement. There ideally is communication specific coordination and governance mechanisms. So what we probably will have seen is that there is governance and coordination, but there's so many other factors that they're required to focus on. Communication can get missed or not get given the priority that it needs. So without that kind of specific focus.
Anita, could you give an example of that? Or
yeah, so I guess there are examples from other countries where their sort of task force or commands are set up with a specific communication group, or communication is really clearly a part of those task force responsibility with clear accountabilities for communication. I can't speak for what's happened necessarily in Victoria, Australia, because I haven't been on the inside, but the sense that I get is that this probably hasn't been a really strong feature of the coordination groups that have been in place. And I'm happy to hear from others who've had better insight than me, but I think going forward, it needs to be really clear that communication is a key function, and it needs the right coordination mechanisms in place. So ideally, and I guess this is where Health West comes in, and the kind of regional approach to this work, is that those high-level coordination groups would have a chain of command down to regional and local coordination groups. So people working at a regional level or at a local level, obviously much more aware and connected to the communities that they work in and what's happening on the ground. And so that kind of two-way between feeding back up to the high-level groups and then also having guidance fed back down to the regions and local areas is really important. Probably goes without saying that coordination groups should be multi-sectoral, and ideally you will want to have people involved who have expertise around communication, but also who are working directly with communities to try and deliver communication activities. So in terms of planning, again, this is obviously all in an ideal world, and hopefully when we get out of this pandemic, if we ever do, there will be a reflection and some evaluation and looking at what we really need in place going forward to be well set up for the next pandemic. But that as a part of the planning, there really needs to be public health communication teams established whose specific role or at least a big portion of their role is comms specific, and that they have the technical expertise to do that work. That there's a national and or both state communications strategy. So again, I'd sort of looked as a part of this review process to see what we had done in Victoria and also at a national level. And from what I could tell, there isn't a specific strategy. There's some mention of roles and responsibilities for communication, but nothing that really gives people a clear understanding of what are the objectives, what are people's roles, and how can this be done in a coordinated way. And again, those communication strategies would ideally feed down into a tailored regional or local level strategy that is seeking to address those same statewide or nationwide objectives, but can really be adapted to address local needs and context. So it might sound contradictory. Obviously, we want to be consistent about our messaging, but different communities will have different needs, obviously, and they will respond to different types of messages as well. Obviously, if the key message is constant, but the way it's delivered may need to be modified.
So does that mean that you kind of be like looking to the maybe state and federal to set some guidelines, and then the tailoring to be done at the local level?
Yeah.
Yeah. Okay. Thank you.
Hopefully what people will see when they get the report, which will be coming soon, hopefully, that there are lots of good examples of how other countries have done this, and how countries where there's more decentralized governance, I guess, to have that high level strategy feeding down into what happens at a local level, and how those strategies can be tailored to be locally specific. So monitoring and evaluation in the context of communication, obviously, it's important always, of course, I will say that, but when we've had a situation like we've seen with this pandemic, obviously so much information changing all the time, and what we also know to be the challenges of an infodemic, misinformation, conspiracy theories, monitoring becomes really important for understanding what are the community's needs, what are public perceptions, what are the kinds of rumours and conspiracies that are starting to get hold on a sort of whole state or whole country level, but also any nuanced kind of conspiracies or rumours that might be happening at a local level. And also monitoring media activity as a part of that. So understanding what's being talked about, but also what messages are getting traction, either in a positive or negative way. So, where we might see a particular person or a prominent person who's really been able to reach people, these types of successes, I guess, but also challenges is really important to monitor on a regular basis. From an evaluation perspective, obviously wanting to know if your messages are reaching people and whether or not they're effective, and that includes whether or not they're impacting perceptions and people's behaviours or their intentions to adopt prevention measures, or what might be preventing them from doing that. And then again, and hopefully we'll see this at the end of the pandemic or in the post-pandemic phase, to really do a full evaluation of systems capacity and performance, to understand how we can build in more infrastructure, more money, the resourcing and the skills, I guess, to be able to do this work well. So hopefully what will happen is this report can inform what is a broader evaluation, at least hopefully at a state level. So are there any questions before I keep talking? No, I can only see a few of you anyway, but this is where we sort of get to the components that are really of interest at a regional level and partnerships at a regional level. So again, wanting the partnership to be multi-sectoral, which obviously they often already are at a regional level, and in instances like PCPs and other partnerships, making sure, again, there's a coordination platform and mechanisms. And I want to emphasize that it's for the communication elements of the work. So I guess if it's being diluted into other platforms or other purposes, it may not get the attention that it needs, and you may not be able to kind of bring together people to collaborate and coordinate on communication specifically. I've talked about the need for a communication strategy, and I think coming down to a regional level, this is where we would want to see those who are part of partnerships sort of signing up to support the implementation of a regional strategy, being really clear about what your role is. Different organisations will have different roles naturally, whether you're in a hospital setting, for example, versus what you're doing to do community-based health promotion or outreach type work. There is a need to know what the training needs are for the region, or if we're thinking on a state level, that would be the same at a state level, but that those needs are identified so that training and resources can be provided. So I think we know that there is a lot of technical information that needs to be communicated in a pandemic. So naturally, the people who are communicating it need to know those key messages, understand why they're important, be able to deal with kind of backlash and hesitancy or misconceptions, misinformation. It's becoming clear that the capacities or the competencies for communication are really complex and need specific kind of attention through training and development. And then again, emphasising the importance of monitoring and evaluating what you're doing at a regional level and whether or not it's having an impact. Okay, so I'm going to start talking more about the nuts and bolts now, I guess, the processes, the practices. How can you do communication and community engagement well? So again, a lot of this is stuff that you'll know. It's already a part of the work that you do, but I guess it's good to reinforce that these practices need to be at the forefront and are really critical to effective communication. So understanding your community's concerns, perceptions, and the sources of misinformation, again, really coming back to the importance of monitoring. Identifying what your community's information needs are. So some people might be happy with the information that they're getting through other sources and just want you to be reinforcing or providing existing information. Other people might need much more tailored information. Some people might be okay with the prevention measures, but not understand what the sort of lockdown measures might be, for example. So it's really understanding the types of information that people really need to be able to implement prevention measures and follow the advice that's sort of been given. Hopefully it goes without saying that you want to be using participatory processes to develop messages and also communication approaches. We talk about this all the time in the work that we do, co-design, making sure that we're consulting to inform, but I think it's been really clear how important that is through this pandemic. Related to that is the need to test messages and adapt them where necessary. So I think without doing this testing, as we're developing new messages or adapting them, we really don't understand whether or not they're understood or whether or not they're having an impact. So this kind of has to be a really ongoing dynamic process of understanding needs, developing messages, testing them, and then adapting them. The importance of using various communication channels and media and sort of not relying on mass communication reaching people. Obviously, some people really want digital kind of communication and that works well for them. Others will need face-to-face methods of communication, or written or radio, or needing to make sure information is being tailored to everybody's kind of needs and preferences. And again, the need for feedback mechanisms for monitoring and evaluation. So I guess in the context of communication for pandemics and health emergencies, the guidance from the World Health Organization and what people tend to be doing, particularly in lower resource countries where there's lots of not-for-profits and development or aid organisations working on the ground to combine communication with community engagement. And I think we're probably, and I know there are some people in the room who have been doing this work and will be able to speak to it when I've finished talking. So the importance of community engagement as a part of communication is to be able to reach more marginalised and at-risk communities. Again, not assuming that any of the communication messages that are going out in a sort of one-way process will reach them. Really important for building trust and with disenfranchised communities in particular. And obviously, where distrust starts to creep in, whether that's for, because of politics, because of misinformation, it's really important that trust is established with communities. Otherwise, the messages that you're putting out are not going to cut through. People are inherently likely to disbelieve them or not feel confident in them. Reducing fear, stigma and discrimination. Again, we've seen how the pandemic has increased discrimination and stigma for some groups, as well as just the general fear in the community about what's happening and who they can trust. And ideally, doing all of this will help to prevent inequalities from being exacerbated. So it's really about trying to make sure that there's equity and equality for all people that you're working with in the community. So again, emphasising the need to be community-centred, adapting to local context, being culturally responsive, using participatory and co-design processes. And I think this is thinking about the role of regional partnerships and local organisations. This is really where you have the kind of connections and the strengths in the way you work to be able to lead some of these participatory processes for your own purposes, but also to be feeding back up to the state government and others to make sure those high-level approaches are factoring in communities' needs as well. So I guess to highlight some additional practices and needs when working with cold communities, which I know you'll all be aware of, but really came through strongly in the literature, mostly because despite knowing the importance of these things, they're still not happening. So this is a kind of really common deficit, I guess, in the responses, whether that be in the States, in Australia, but also elsewhere. So translation of messages and materials obviously really important and has been a big problem. So that's making sure you're translating into as many languages as possible that is practical. Obviously, there's a lot of languages spoken, so it's not necessarily going to be possible to translate into all languages, but to try and do it for as many as possible. And to do it in a timely way so that information that's changed 2 weeks down the track is not still being disseminated, and that people have up-to-date information. So that's obviously 2 really key things, and it's come through many studies that have been done in Australia. Same with the use of interpreters. I think people acknowledge the challenge of being able to access interpreters, but it's important that you're trying to engage them, particularly around service delivery more so. Establishing a culturally and linguistically diverse workforce. So evidence from the literature included liaison officer roles, CALD advisors and bicultural workers. I guess the liaison officer or advisor roles might be more kind of central agencies, but bicultural workers very much more on the ground and leading some of those participatory approaches that I've talked about. The need to collaborate more with multicultural and settlement services. So if you're thinking about forming a regional partnership for communication, to be in making sure that those services are involved. Same with engagement and use of ethnic media. So that should include in your partnerships, but also how you're disseminating information. Obviously well placed to meet community needs. A really strong theme throughout the literature, and this is kind of in every country, and evidence from Australia as well, is the importance of involving community leaders and faith or religious leaders to disseminate information, but also as a way of mobilising communities. So they're often people that communities trust. So if there's doubts about governments, for example, or there's doubts about what works, or there's confusion, these community leaders can support you to work better with communities. And I've talked a lot about co-designing messages and resources, but making sure that the communities that you're trying to reach, and this needs to be specific to each community, not assuming that you can just adapt generic messages and that will be appropriate for all diverse communities.
Anita, we've got a question in the chat.
Yep.
Could you explain a bit more about the different co-design approaches?
Yeah, so there's, in terms of what came through the evidence, this is where the challenge lies. There's lots of discussion about the need for co-design, but in terms of evidence of what has worked, I would say there was limited evidence. I think needing to convene or have ways of working with communities to develop resources. I can think of one example off the top of my head from the review, which was a study done in Norway to work with a community, establishing a group of people who decided on what the messages were going to be based on what they were hearing from their community, based on, it was a Somali community, I should say. So they were kind of leading the consultation with the communities to come back and develop what those messages will be, what the preferred formats were, and then had a very specific approach to dissemination, which was that those the messages and the resources could only be shared within the Somali community. They weren't for public distribution. So they really used, I guess, a networking kind of phone tree way, I guess, of communicating information that was very specific to that community and only shared within that community. So I think co-design, obviously, and I know there are people in the room who have been involved in co-design, is really resource intensive. You need to be able to resource communities who are contributing to the co-design process, being able to provide sort of technical support as well, developing messages that do bring in official advice, and then having those messages tested before they are distributed widely in the community. So again, the report does provide a number of resources, guidelines, toolkits that will support you to be able to do co-design processes for communication and messaging. I don't know if that answers the question, but I guess the process is not different from how you would approach co-design in other ways. I guess there just needs to be a bridging of the official advice with what's going to work with a community. In terms of practices that have been shown to be effective, things like messenger groups and WhatsApp has sort of come through as consistently an effective way of reaching communities. So having leaders involved in sort of developing and agreeing on those messages and then distributing through those networks can be really effective. So I think, I don't know if I've answered the question, but I know there are people in the room and they may not want to share, but who might be able to share their own experiences of co-designing messages and resources and getting them out to community.
Is there anyone in the room that would like to share some of their learnings?
Yeah, so, I was just wondering whether we are co-designing or not, so we collaborate with community representatives before conducting our sessions. And, during the sessions our volunteer healthcare professionals provide, we collect our observation notes, and based on notes, we revise our session content. You know what I mean? So, so I'm not sure whether you will call it a co-design or not. I was just wondering.
I would, and the extent to which people can be involved in developing messages, obviously, it still requires some support from the people who are like yourself, who are doing the work. So I think if they're bringing advice from community, they're involved in actually framing the messages. They're involved in going out and seeing if they work with the community and then helping to adapt them. Then I would see that as a co-design process in this context, specifically about messaging.
Great, good to know. Thank you.
Doing it already.
So yeah, I think that the idea of the phone tree thing, that seems really awesome. And is that also like kind of using WhatsApp or something like that to test messaging, or have you heard of any ways of because from my perspective, whenever I think about getting people into a room, or even having a meeting like this is not going to work. So I'm just wondering if you have any insights into ways people have used chat apps or social media to take in that kind of information.
Yeah, so I think, again, emphasising the importance of working with community leaders, I think that's got to be driven by the community, and the needs need to have come from community. So I think, stepping back and giving the opportunity for those to be developed. I think the challenge, if you're using something like WhatsApp to test messages, is once they're out. And so, and they can travel far. And so having ways to test before you kind of go out to a big number of people would really be ideal. But, sometimes you can't prevent information from moving in that way anyway. So, I know we often think about workshops or formal ways like this of trying to do that kind of co-design and testing, but I think they can start organically within the community, but then providing some of that technical support around whether they're that they don't contain misinformation for starters, but then that they're suitable for the particular community that you're working with. And again, there's lots of tools, templates, ways of being able to work with communities to test messages, do what is called lots of things, but social listening, trying to collect information that is relevant, that is culturally relevant, it's in context, and that can then inform the message development.
Yeah, I just thanks Anita, that was really great information. I was thinking about where the co-design process can begin, you know, rather as well as, you know, engaging with communities to see what it is that what information they need, but and how it's delivered. But I'm wondering even earlier, like designing, doing the communication strategy, like co-designing the overall strategy. I've never seen it done before, because it usually happens sort of higher up the chain, and then it's up to the implementers to go out there and follow the steps of the strategy. But it'd be great to see that process developed at some point, or if anybody knows where it has happened, let me know. So
Yeah.
I've got.
I think that's a really good point, Karen. It really does need to start with thinking about how you incorporate community perspectives into strategies, and also resourcing their ongoing involvement. So, you know, ideally, if you've got bicultural workers or other people who are in a paid capacity supporting this work, who have already got the connections and the relationships with communities to really lead this with guidance and support from organisations. So it's something that needs to be resourced, I guess, is the best advice I can give. To put money into employing people, and put money into doing the co-design work. I think people who have got connections with the community will know where to go to get the feedback, and can come back with the information, refine the messages, refine the resources, and then go out to a wider audience.
Anita, it seems these relationships required for the system to work take time to develop, and there's a lot of infrastructure and resourcing involved.
Yeah.
Do you think there's an argument that these systems could be utilised for other types of communication when we're not in a pandemic or in an emergency response?
Yeah, I do, and I know we've talked about it, Tanya, and it's not something. The nature of the review obviously found a lot of evidence on pandemics and health emergencies, but I think investing in infrastructure and a workforce that can communicate effectively with diverse communities is obviously going to have benefits beyond the pandemic. So, you know, I think even if we look now, even thinking about the recovery phase, if we can use that terminology, you know, people feeling socially isolated, wanting to be more connected, mental health more broadly. I think while the nature of communication in a pandemic is different, I think having the infrastructure and the workforce to be able to do better public health communication means it's a good investment, and it's going to have ongoing benefits. The other thing is that you need to be ready to respond to the next emergency anyway. So, you know, bushfires, for example, other instances where it's not a pandemic, but it's an emergency, and it requires similar kinds of communication to what happens in a pandemic. So I think making the investment, even if it's in a context of a pandemic, will have long-term benefits for being better communicators, and reaching communities with information that they need.
Yeah, I wanted to share something. So this year I joined CEH, but I was and still am a bilingual health educator. And it started in the Women Project this year. And we did lots of outreach because, like you said, there was no communication strategy. We had to rely so much on our in community connections and our understanding of the complexity of that happens within the community itself, within a certain community. So let's say there are factors that will prevent certain messages and certain ways of dissemination of, scientifically proven facts that you want to hand over. And there was lots of co-designing in many stages. For example, creating social media tiles. And once we finalize them, how are we gonna send them? WhatsApp sometimes was the only way because some certain community members, they're only communicating through WhatsApp.
Yeah.
Facebook, on the other hand, we had to work harder because even with government messaging, mainstream media just doesn't work, and even mainstream social media doesn't work. Some people will be, hidden in closed groups. So we had to wiggle our way into there. And some people from senior ages, they're not tech savvy at all. So we would offer for them to, how to use Zoom, for example, and deliver a workshop. And it was back and forth all the time, and iterations and prototypes. It was a lot of work, but I was operating in the north, and as you know now, Hume is the highest vaccinated region all around the world. It was lots of work, but it worked. But it would be much easier in the future if there was a strategy established, known, so not everyone would be, working spontaneously. It worked, but it would be much less stressful in the future. Hopefully not another pandemic, but yeah.
Hopefully. Thank you so much. I think you've spoken to that better than I ever could, obviously having the experience working in community and doing this work. And so hopefully we will see better resourcing and some of that higher level guidance that people can then adapt for their own local context going forward. And we're still in a pandemic, so there's still time for it to happen now, hopefully, not for the next one. So yeah, I think obviously Aman's got some really great insights that maybe we'll be able to share at another time that's more practice-based than the research that I've done. But yeah, again, there are some really great resources that will come with the report. You'll be able to look those up.
All right, I'll just, I noticed we've got some people dropping off and we're over time. So I'd just like to thank Anita for her presentation today. And for everyone else for sharing your insights and questions as well. You're welcome to log off unless you're wanting to hang around for the Health Literacy Alliance meeting, which will be a very, very brief few minutes, I think, aiming to wrap off at about 2:30. So thank you for joining us today for those who are leaving.